Welcome to study session 10 of NSA 305, Human Behavior in Health and Illness. This study session has to do with healing options as in medical care. Health is the most precious of all things, and it is the foundation of all happiness. Traditional medicine has developed in various communities in Nigeria in response to the health need of the people, using locally available resources for the alleviation of their health problems. In this study session, you will be introduced to modern healthcare concepts, various complementary and alternative medicine, and the safety and regulations of complementary and alternative medicine. When you have studied this session, you should be able to describe the modern healthcare system, discuss various types of complementary and alternative medicine, and lastly explain safety and regulations of CAM. The modern healthcare. In the world we live today, many influences strive to pull us away from the healthy life we could live to a life full of stress, disease, and generally poor health. There is no doubt that advances in modern medicine have increased our average life expectancy and decreased child mortality rates. But strangely, there are new health risks and diseases that are coming to notice. The classes of modern healthcare includes 1. Primary care provider. A primary care provider is a healthcare practitioner who sees people that have common medical problems. This person is usually a doctor, but may be a physician assistant or a nurse practitioner. A primary care provider is your main healthcare provider in non-emergency situations and is expected to provide preventive care and teach healthy lifestyle choices, identify and treat common medical conditions, assess the urgency of your medical problems, and direct you to the best place for that care, and lastly make referrals to medical specialists when necessary. Primary care is usually provided in an outpatient setting. Then we have the nursing care. Registered nurses who are licensed by the state, having graduated from a nursing program and passed the board examination, fits into this category. Advanced practicing nurses have education and experience beyond the basic training and licensing required of all registered nurses. These nurses include nurse practitioners, clinical nurse specialists, certified nurse midwives, and certified registered nurse anesthetists. Then we have drug therapy. Licensed pharmacists who have graduated training from a college of pharmacy fits in here. Pharmacists provide information to patients about medications while also consulting with healthcare providers about dosages, interactions, and side effects of medicines. They may also follow your progress to check the safe and effective use of your medications. And lastly, we have the specialty care. The primary care provider may refer you to professionals in various specialties when necessary. Complementary and alternative medicine. Complementary and alternative medicine is the use of treatments that are not commonly practiced by the medical profession. The field of complementary and alternative medicine tries to prevent and treat different conditions with techniques such as healing touch, energy, and herbal medicines. Many complementary medicine therapies have been around for centuries, and there has been research to show that some of these techniques can help with problems like pain and nausea. Alternative medical systems include 1. Acupuncture. This traditional Chinese medicine technique uses thin needles to stimulate various points around the body. Each point corresponds to a specific condition. The aim is to restore a balance of energy and good health to the body. And then we have biologically based therapies. Biologically based therapies in complementary and alternative medicine use substances found in nature such as herbs, foods, and vitamins. Some examples include diet, herbal products, and megavitamins. It also includes the use of other so-called natural but yet scientifically unproven therapies. For example, using shark cartilage to treat cancer. Safety and regulation of CAM. Many of the claims regarding the safety and efficacy of alternative medicine are controversial, as some alternative treatments have been associated with unexpected side effects which can be fatal. One of the commonly voiced concerns about complementary alternative medicine is the manner in which it is regulated. It has been suggested that current regulatory bodies have been ineffective in preventing deception of patients, as many companies have relabeled their drugs to avoid new laws, and there is no general consensus about how to balance consumer protection with freedom to choose remedies. Advocates of complementary medicine suggest that regulation of the industry will adversely affect patients looking for alternative ways to manage their symptoms, even if many of the benefits represent the placebo effect. With this, we've come to the end of this study session. Thank you for listening.